Now coming to the ankle joint, this joint is also called as the talocrural joint. This joint is a hinge type of synovial joint. This is also a synovial joint, but it is hinge type. We have seen already the classification of the joints, and in case of synovial joint, there is a type called as the hinge type. So this is a hinge type of joint. The articular surface is between the lower end of the tibia. This is the lower end of the tibia with its medial malleolus. This is the medial malleolus, and the lateral malleolus of the fibula, which will be articulating from above, and from below, this is the talus. So the inferior transverse tibiofibular ligament will be present here. So all these the three bones, the tibia as well as the medial malleolus, the fibula with its lateral malleolus as well as the talus will be articulating with each other. So these will be the articular surfaces. Below, as I said, will be the wedge-shaped talus bone here. Okay, so these are talus bone here, which will be articulating with the tibia as well as the fibula as well as a ligament which is present there. This is called as the inferior transverse tibiofibular ligament. Stability of the joint. This is a very stable joint, and it is maintained by interlocking of the close interlocking of the articular surfaces. So these bones are in very close proximity to each other, and they will interlock each other. The close interlocking of the articular surface of the three bones, and strong collateral ligament on the sides, as well as the crossing of the tendons, especially the long tendons which are coming from the anterior compartment of leg as well as the posterior compartment of leg. They will be all crossing. 4 in the front, which are coming from the anterior compartment, and 5 from the behind, coming from the posterior compartment of leg. All will stabilize this ankle joint. There are also ligaments which help in the stability of the knee joint. One is the fibrous capsule itself, then the deltoid, or also called as the medial ligament, as well as the lateral ligament. Medial ligament is also called as the deltoid ligament. Blood supply to this ankle joint is by anterior and posterior tibial arteries as well as the peroneal arteries. So all these are branches of the popliteal artery. Popliteal artery divides into an anterior tibial artery and a posterior tibial artery, and the posterior tibial artery also gives a branch called as the peroneal artery. Nerve supply is by the deep peroneal nerve as well as the tibial nerve. Tibial nerve will be supplying as well as the deep peroneal nerve, which is also called as the anterior tibial nerve, will be supplying the ankle joint. Coming to the movements of the ankle joint, there are two types of movement. One is called a dorsiflexion and the plantar flexion. Dorsiflexion is such a movement in the foot where you lift the foot upwards and try to show the sole in the front. So that is called a dorsiflexion. And the plantar flexion, where you allow the ankle joint to drop the foot, that is called as the plantar flexion. So the dorsiflexion is done by the muscle in the anterior compartment of leg, the long muscle of the leg. This is called as the tibialis anterior, which is the principal muscle in dorsiflexion, and there are accessory muscles like the extensor digitorum longus, extensor hallucis longus, as well as the peroneus tertius. The plantar flexion will be done by the muscles in the posterior compartment of the leg, that is the gastrocnemius and the soleus, which will be actually inserted to the calcaneus bone, and whenever they contract, they help in the plantar flexion. Then there are accessory muscles like the plantaris, tibialis posterior, flexor hallucis longus, as well as the flexor digitorum longus, all muscles in the posterior compartment of the leg. So these are the muscles and these are the movements. There are only two movements here at the ankle joint, dorsiflexion as well as the plantar flexion. Then coming to the subtalar joint. So if you see here, this is the picture showing the different joints here. This is the tibia and the fibula at the lower end, and here you can see the talus, and here is the calcaneus. So the joint between the tibia and the talus, this is called as the ankle joint, and this is the talus, and between the talus and the calcaneus there is a joint, this is called as the subtalar joint. So these two joints are different and the movements at these joints are different. So you should remember. So this is the ankle joint between the tibia, fibula and the talus, and the subtalar joint between the talus and the calcaneus. As the name indicates subtalar, so it is below the talus. So this subtalar joint is also called as the talocalcaneus because it is articulating between the talus and the calcaneus. Okay. So this is a plain type of synovial joint. So if you remember the classification, in case of the synovial joint, this was the last type, the plain synovial joint. So this is articulation between the bones, talus as well as the calcaneum. The inferior surface of the body of the talus, and the convex facet on the middle 1/3 of the superior surface of the calcaneum. So this is the two articular surface which are facing each other. What are the ligaments which help in the stability of the knee joint? One is the fibrous capsule because this is a synovial joint, so it has to have a fibrous capsule. Then we have the lateral and medial talocalcaneal ligament. If you see here, there is the lateral talocalcaneal ligament, and on the other side will be the medial talocalcaneal ligament. So there is a small ligament here, if you can see here, which is cut here. Actually it is not shown completely, it is cut. This is the talocalcaneal ligament. This is on the lateral side, on the medial side will be the medial one. Then there is interosseous talocalcaneal ligament, which is thick as well as very strong ligament, as well as the cervical ligament. If you can see a deep inside, you can see here, this is the cervical ligament. These are the four ligaments which help in the stability of this subtalar joint. So the four ligaments are fibrous capsule, lateral and medial talocalcaneal ligament, interosseous talocalcaneal ligament, as well as the cervical ligament. These are the four ligaments which help in the stability of the subtalar joint. Why this joint is so important? Because there are two important movements which are taking place in this joint. One is called as the inversion of the foot and the eversion of the foot. So these are two important movements which will be taking place at the subtalar joint, inversion and eversion. If you remember, at the ankle joint we have the plantar flexion and the dorsiflexion, and in case of the subtalar joint we have the inversion and eversion of the foot. So there are different movements at these two joints, ankle joint and the subtalar joint, even though they are very close to each other.